It's, it's never too early to talk about mental health.
Hello there, Dr. Nefertiti Pointer here with the Devereaux Center for Resilient Children. Thank you for listening. Let's continue the conversation about mental health. So if you caught the last video, we talked about mental health as what happens when children need a Band-Aid for their heart, right? We see formal definitions of the word mental health. We know what mental health means for us, for grown-ups. But how do you use this word with our babies, our toddlers, our preschoolers? It's never too early to talk about it. So today, we want to keep thinking about creative ways to use this language that is going to be a developing resource and tool for our little ones. Because do you know when you are able to process your emotions, that's a tool. And not just a tool for school, it's a tool for life. And so today I want to keep on digging into this, and I want to take on some big words. The first word I want to talk about is, this is a big one. Anxiety. Now, you have to meet your children where they are. Remember, I told you, this conversation is first about you getting safe. You have to get safe first, and then you meet your children where they are in this discussion. Now, children may not be able to say the word anxiety. They may not be able to spell the word anxiety, but they can feel anxiety. And so might you say to them something like, anxiety is a feeling that sometimes you can feel it in your belly. It feels like 1,000 butterflies down there. That might be anxiety. You can feel anxiety in your heart. Your heart starts to beat super duper 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 fast. That's anxiety in your heart. You might feel anxiety in your fingertips. You can even feel anxiety in your toes. But anxiety is a feeling that sometimes comes over your body when you have different feelings. Now again, you take from today's message what matters for you. But first of all, you get safe around this conversation, and then you meet your baby, your toddler, your preschooler, your school-age child, or even your young adults. Because this conversation is one that is necessary for them as well. We're trying to create safe spaces to talk about anxiety. And it's a feeling that can be felt in all parts of our body. And different things bring about anxiety. Being scared, being afraid, being alone. All of those things are examples of what can bring about the feeling of anxiety. So, want to think about that with me? The second thing I want to think about today is what kind of questions can we ask our children to engage in these kind of conversations? I think it's important to think about just open-ended questions. I have a 6-year-old and a 17-year-old. And some days my go-to question is, how was your day? How was your day? And there's nothing wrong with that question. There really is nothing wrong with that question. But when I really want to talk with my babies about their feelings, I can say things like, what great things are you looking forward to at school today? You know, if they look at me and say nothing, or my 17-year-old tells me about a test that she has to take, or my 6-year-old talks about a friend who's been absent from school because he's ill, that can bring about feelings of anxiety, just having to go to school and deal with that. But the nice open-ended question that I present to them when I say, what's the best thing that could happen at school for you today, is a way for me to help start to process their mental health. And today we're talking about the feeling of anxiety. Now, before you go away from me, I also want to talk about what can be the opposite side of anxiety, and that is hope. That is hope. I say to my girls, you are just enough of all the right stuff. That's what I say to them. You're just enough of all the right stuff. So we're not going to let anything get in the way of your well-being today, what you want to do. You're just enough of all the right stuff. And that's a way to keep us encouraged, to never give up on ourselves, and to know that this is maybe a temporary feeling for a temporary situation. It's not going to last always. And that's a good way to help our babies, our children, think about this word hope. When you're rocking your baby, talk about tomorrow, talk about next week. That's when we think about hope, because hope is what happens beyond what the eye can see today. All right. I hope that makes sense. I hope you're still listening to me because sometimes I can get long-winded, but this conversation is so important to me that I hope that it's just enough of all the right stuff and that you have some idea of how to talk about anxiety and hope. I'll see you later. Thank you for listening.
It's never too early to talk about mental health.